Well, now we understand that the Speaker of the House, Nancy Pelosi, is going to try to pass the Senate bill without having her members vote upon it. And it shows the level of embarrassment that the House has, that they have to vote on this very bad bill. They are going to deem it passed. It's what we like to call scheme and deem, because the American people deserve, if there's going to be a vote, that it be done out in the open. But I understand why they don't want to vote for it. They don't want to vote for a bill that cuts $500 billion out of health care for seniors. They don't want to vote for a bill that puts $500 billion of new taxes on medicine and medical devices, which we know is just going to increase the cost of health care. And they don't want to vote on a $1 trillion new entitlement program that does not lower the cost of health insurance for Americans. Now, the reason why we entered into this health care debate, at least the reason we were told by President Obama when he campaigned and then when he first was elected and called this issue to the nation's attention, is that we wanted to lower the cost of health care. We wanted to reduce these skyrocketing costs. They've gone up 130% in the last 10 years. But this bill doesn't do anything to lower the cost. In fact, folks who are out in the individual market trying to buy health insurance will see, according to the Congressional Budget Office, their health care premiums go up 10 to 13% over the next 10 years. We don't need to cut health care for seniors. We don't need to raise taxes. And we certainly don't need to plan and pay for a new entitlement program that we cannot afford. Our country is in dire financial straits. What we need to do instead is a step-by-step approach, like we've proposed on our side of the aisle, to let insurance companies compete across state lines. Give people who can't afford health insurance a tax credit so they can go out into the market and buy health insurance themselves. That'll put the consumer back in the health care marketplace. And when we know that consumers get involved, they'll shop around. We see it right now with auto insurance. Everyone can recite the commercials of the auto insurance companies who are competing for our business. We need to do the same thing with health insurance companies. What we do not need to do is pass this bad bill. We need to start over, get it right, and do what's right for the American people.